Dr. Anurag Saxena. I am Cluster Head of Neurosurgery at Manipal Hospitals, Dwarka, New Delhi. And today I am going to discuss about epilepsy and seizures. So the common question asked is, what is epilepsy and what is seizures? Are they same? Are they different? So seizure is actually a sudden onset and abnormal electrical activity in the brain, which manifests itself as an involuntary controlled movements of the body. Most commonly, they are called as convulsions, which means you can have sudden shaking of one part of the body or whole of the body. Patient may lose consciousness. It can also manifest as blank staring spells. That's called as absence seizures. They can have falls. Patients can have multiple falls. And certain kind of seizures, you can have very rarely you can have laughing tendency called as gymnastic seizure. So it can manifest as any abnormal movement where patient doesn't have a control on. These are seizures. The causes of seizures can be any irritating focus to the brain. It can be because of head injury, infections. It can be because of tumors. It can be because of a clot on your brain, stroke, and then causes of medical causes when like hypoglycemia, low blood sugar, you have any other metabolic problems, you have infections in the body which can lead to seizure problems. You can have hypoxia, which is lack of oxygen, which can lead to seizures. So seizure is basically a symptom of an underlying problem in the brain. What is epilepsy? Epilepsy is completely different from seizure, but it is a neurological disorder. So, technically speaking, epilepsy is when you have two unprovoked seizures in succession at least 24 hours apart. When I say unprovoked, which means there is no definite cause of seizure, then it is called as epilepsy. So, epilepsy is a neurological disorder where the patient has a tendency of having seizures. One or two seizures in very different time apart is not called as an epilepsy. By definition, epilepsy, most of the time we do not know what is the cause of epilepsy because, as I said, the seizures do not have any cause. Then we label it as an epilepsy, and there has to be a recurrent tendency for having seizures. The causes of seizures are usually the chemical imbalance or neurotransmitter imbalance in the brain, or irritation or a direct irritation to the brain, for example, in terms of head injury or infection or tumors. I hope this message was clear. Thank you.